Hi, welcome to Doula Tea Talks, where I spill the tea on pregnancy, birth, postpartum, and everything in between. My name is Maya, and I am a certified birth and postpartum doula, as well as a yoga instructor specializing in prenatal yoga. So, today's topic is going to be all about the first 48 hours after your baby is born. Now, whether you are preparing for a home birth, a birth center birth, or a hospital birth, immediately postpartum, you're likely going to experience an emotional roller coaster. It's so important that we talk about it because oftentimes moms feel like they're going crazy or they feel like it's not normal when in reality, what you're experiencing is absolutely normal. You may feel a mix of joy, overwhelm, stress, exhaustion. All of this is completely normal. When we talk about pregnancy, birth, and then postpartum, there is a extreme significant shift when it comes to your hormones, especially on day 2. The huge hormonal drop on day 2 can oftentimes lead to baby blues. Now, baby blues is something that a lot of women experience, and the bad thing about baby blues is you're sad. You feel really sad, really emotional. The good thing about baby blues is typically within 2 weeks, it will go away. So if you are experiencing baby blues and 2 weeks prior to when you first started feeling this, you're still feeling weepy or sad, or maybe it's gotten worse, now that is when we would need to talk to a care provider, either your doctor or your midwife, to discuss possible solutions for you. Let's talk about some coping mechanisms. So, ways that you can ground and recenter yourself during this time can include practices such as breath work. Hopping on YouTube and doing a quick breathwork practice can be extremely grounding, bringing you back into the present moment. Other things you can do to help would be sitting outside, just spending time outside, even if that's, just 5-10 minutes a day, can really improve your mood and overall well being. Okay, now let's talk about baby and baby's adjustment to their new environments. So let's take a moment to put ourselves in baby's shoes, right? So your baby just spent their whole existence in your body. Their whole entire life up until this point has been living within you. Fun fact, actually, baby girls are born with all of their eggs. So your baby has been living in your body since you have begun living. So just to kind of put that in perspective, to say the least, this is a dramatic and very drastic shift for your baby. And it's understandable that your baby is going to crave that closeness and connection with you. The most important thing to remember here is to keep baby close by, as close as you possibly can. The best thing to do for your baby during this time would be to have skin to skin contact, especially within the first hour after birth. Your baby is naturally going to crave a closeness with you. I promise you, you are not spoiling your baby. Spoiling a newborn is impossible. During the newborn phase, but especially the first 48 hours, it is completely normal for your baby to cry when they are apart from you. It is completely normal for your baby to cluster feed. If you're breastfeeding, your baby is going to want to nurse. It's going to feel like forever and it's nonstop. It's completely normal. And it's going to help bring your milk supply in. Another completely normal thing that babies will do is have short wake windows and short sleep windows as well. So your baby might be awake from anywhere from 15, 30, 45 minutes at a time, and then they fall asleep. Your baby is going to spend more time sleeping than awake. So absolutely take advantage of this and get some rest, mama. Now, a really important thing to note when discussing sleeping is that if your baby is sleeping past 3 hours, you absolutely need to wake them and nurse them or bottle feed them. It's important to remember that breastfeeding is a learned concept. Nobody is born with an innate knowledge of how to breastfeed their young. So, right off the bat, give yourself grace and give yourself time to know that this will be a learning process, not only for you, but for your baby as well. If you are giving birth in the hospital setting, it is so, so, so helpful for you to utilize the lactation support that you have at your fingertips. So every hospital will have a lactation consultant on hand. So be sure that if you're birthing in the hospital setting, that you are talking to a lactation consultant at least 3 times before you leave the hospital. Yes, I said 3 times, and it sounds like a lot, but it's absolutely not a lot. When you're in the hospital setting, you have free support through the lactation services. Absolutely utilize that, okay? Because the bill that you're about to get in the mail, babe, you better utilize every little thing you can out of it, okay? Now, if you're having a birth center birth or a home birth, it is very likely that your midwife or birth doula will be able to assist you when it comes to nursing and latching. The first milk that your baby will be consuming is called colostrum. It is sometimes clear, but most of the time it's like a golden color. This colostrum is liquid gold. Doesn't even explain how amazing colostrum is. It really doesn't even begin to touch the surface. Colostrum is packed, and I mean packed, with nutrients, antibodies, and really just anything and everything your baby is needing right now. Okay, now let's talk about something that rarely anyone really talks about: postpartum bleeding. So, most people are surprised to discover that after giving birth, they bleed quite a bit. So, after giving birth, it is completely normal to pass blood clots, and some of them can be fairly large. Your blood clots can be anywhere from the size of a penny to the size of a golf ball. Now, if you're having blood clots bigger than the size of a golf ball, definitely reach out to your doctor or midwife. But if you have blood clots the size of a golf ball, don't freak out, babe, because I warned you about it, okay? So after birth, you are really going to want to utilize adult diapers. And a lot of women are like, I don't want to wear a diaper. Babes, put on the diaper, okay? You'll thank me later. So you can typically expect to have a heavy flow for roughly 5 days after giving birth. And slowly but surely, it will taper off, kind of like your period does. It is also important to note that your period might not officially return for a while. Especially if you're breastfeeding, your period might not return for months or maybe even years after you have your baby. And when I say years, that is a little dramatic, okay? If your baby is 5 years old and your period hasn't returned, we should probably look into that. Now, within the first 48 hours, it is so very important to have support around you. Whether that's your partner, your mother-in-law, your sister, your best friend, whoever that is, ensure that you have support and ensure that these people know that you are counting on them for support during this time. I personally recommend within the first 48 hours not having anybody visit unless you are comfortable with this person seeing you butt-ass naked, okay? And I say this because immediately postpartum, you are so vulnerable. Although you might not be naked, you're going to feel like a mess and you might look like a mess. So ensure that whoever is coming over, you are absolutely comfortable being your true, authentic, messy self in front of them. These early postpartum hours are tender and sacred, and they oftentimes set the stage for the rest of your postpartum experience. In my upcoming newborn education course, we go even deeper into these topics, helping you prepare for your best postpartum yet. We talk about everything in this newborn education course, from taking care of yourself all the way to taking care of baby. I would love to invite you to click the link down below in the description box to go ahead and check out the newborn education course. It will officially be launched October 10th, 2025, so stay tuned for that. If you enjoyed today's video, please be sure to like, subscribe, and hit the bell icon, as well as share this video with a mama who needs this knowledge. Thank you so much for joining me for today's video, and I'll see you in the next one. Bye!